with this world-renowned plastic surgeon who has a lot of tips on making us look more beautiful and more glamorous and always more younger. Introduce yourself to the camera, doll.
Hi, my name is Dr. Joseph Pober. I actually have an office here in the city on 83rd and Park, 975 Park Avenue, and also in Ridgewood.
In Ridgewood?
Absolutely. Absolutely.
That's funny.
That's funny, only because of one thing. What I do on Park Avenue is cosmetic plastic surgery, facelifts, eyelids, noses, make people permanently better looking and more wonderful in their own feeling. I like to give people back their self-esteem. As time goes by, the different things you want to do. But in today's world, everyone wants instant gratification. So what I did is opened a Medi-Spa. I opened an entire level of wonderful instant changes with injectables like Radiance, Juvederm, new cheekbones, new chin, new lips, immediately, no downtime.
Immediately.
No downtime, and that's the wonderful thing. I've been specializing in cosmetic surgery for over 20 years, and what I'm doing now is what I've been doing before with fat injections. I used to do a lot of fat injections, facial recontouring. I was in Vogue, I was on Oprah. I was doing facelifts that are faint-hearted, in other words, using fat to give you a better look, a volumetric facelift.
Yes, I was reading that a lot of, this is a new procedure that you could use your own fat to fill up lines and other things that you want to correct in your appearance.
Absolutely. It's a new procedure they're marketing right now. I've been doing it for over 10 years. I've written a textbook that actually helps people learn how to do this exact procedure. And that I find to be the newest and hottest thing. That's a wonderful way of doing it, but now with injectables, you're there.
It sounds like it's a healthier way, an alternative instead of silicone or anything else.
Absolutely, because silicone doesn't rejuvenate you in a positive way. It blows you up, but it doesn't rejuvenate you. Fat.
It's also poisonous too if you don't use it correctly.
Absolutely. With fat is a stem cell. It actually can not only rejuvenate you, it actually can replace certain tissues you may have lost. It rebuilds muscle. It can actually become a little bit like bone substance. And what we have is injectables that also do the same thing now. Radiance is like bone. Juvederm is like fat. And we love plumping up lips a little bit. And we love giving new cheekbones and chins instantly in a Medi-Spa arena. We only do that during surgical procedures. I'm actually a craniofacial surgeon.
It's fascinating.
It is fascinating. It's the newest way to go. And the lovely part about it is there's no downtime. Today people don't have time to be out there and wait for a result. Even 2 or 3 days for eyelids or 5 days for a facelift is too much for people. They want to get instant benefits, and that's what we can do with our injectables, with our fat injections. All these procedures now are opening doors for people that they couldn't have before.
I'm very curious. Of course, I've interviewed all the Real Housewives of New York, all the Real Housewives of New Jersey, but Jill Saranow has just been doing a liquid facelift, and that's with this Botox. Tell me, what is that all about? Do you advocate that?
Well, I like Botox, but I think Botox has its limitations. All it can do is really eliminate dynamic changes on animation, and I find that somewhat restricting. If you have deep frown lines that you'd like to eradicate, or deep forehead lines you'd like to eradicate, or maybe change certain dynamic features you have, Botox is a wonderful component of total care, but it doesn't give you new changes. What I like to do is enhance existing features, change your nose, change your cheekbones, give you higher cheekbones, change your chin.
You could do that?
I could do that within seconds.
I can't believe it.
It is unbelievable. It's unbelievable. And if you have a hollowed eye appearance, a little bag, we can do injectables that'll eradicate that appearance. And the beauty of it, there's almost zero downtime to it. You look good immediately. You get plumper lips, you walk out with that feeling, and unlike Botox, it distorts your movement a little bit. There's no distortion here. It actually moves the way you move. It regains some of your nuance of expression. And what I love is that capability of doing that instantly with no donor site deformity, no negativity is associated with that. It's all positive, and I love that about it. It's a wonderful thing.
Tell my audience audience, do you have a lot of celebrities?
We do a lot of celebrities, and as you know, celebrities like to be quiet about it, so I can't mention any names. But what I find is in New York City, I do a lot of talk show hosts.
Really?
Because they have to look good on the spot. They'll come in, get something done before they go on the air.
That's like me.
That's right. They come in before they go on the air, get it done, and walk out looking amazing. It's as if they were out about exercising. People say, why do you look so great today? Oh, no reason at all. I just look that way naturally. And I'm saying, well, gee, that's really kind of you to not mention me.
but you're getting paid, so that's important.
That's important.
You're getting paid. You're getting the revenue, and that's what it's all about.
I have no qualms with that. What I would hope, though, is that people become more outspoken about plastic surgery, because plastic surgery has changed so many lives, and it's hard to imagine someone stays infinitely looking great without a little bit of help. And why not use the newest technology? Why not use the newest science? Plastic surgery is at the forefront today of medicine. It actually allows us to look, normal people to look even better than they can, and prophylaxis is what it's all about.
What do you think about Joan Rivers? Do you think she...
Joan Rivers is a mature woman, and she's tried to do the best she can to look her very best. And if she's in a right hand, it looks terrific. And if she's in a wrong hand, it doesn't look quite as terrific. You can't, I think what she's trying to do is wonderful, but sometimes she gets a little misguided as to who she goes to get it done. And that's what it really is. You can't blame someone for trying to be wonderful looking for the rest of her life, and I admire her for doing it, and I admire things she's written too. She's done some wonderful things for people in terms of plastic surgery, but sometimes you have to select who you go to just a little more carefully, because you could look amazing with the right person, and you could look a little less than amazing with the wrong doctor. And that's what it's all about. You have to go to a qualified plastic surgeon to get the best job possible.
Tell my audience, where can we go to find out more information about what you're offering?
The best place to go is my website at www.drpober.com, drpober.com, and this way you'll get a lot of what information that you need, because the website is always a good place to start, and obviously the best place to visit be my office. I'm right in New York City on 83rd and Park, 975 Park Avenue, and they can call us anytime at 212-517-9042. That's 212-517-9042, and that's an easy way to start and get launched to where you want to be.
Let's have some champagne.
Toast, absolutely. Absolutely. It's an absolute pleasure.
Thank you so much, Don.
Thank you so much. Thank you. Thank you.
And we'll be back in a moment, Don. Some more interviews right here at the World Trump Bar, located at 845 United Nations Plaza. Pink champagne kisses.
I've had quite a few done, right?
And you're happy with the results, right?
Very happy.
Well, your skin is beautiful. I don't see a line on your face. Not a line on your face. Gorgeous, gorgeous. Can I ask you how old you are? You won't tell me.
How old do you think I am?
Well, I'm sure you're younger than what you know, I'm sure that if I say your age, you're a lot younger.
Yes.
I don't know, about 43? Is that good?
Older. I'm older than 43.
You're older than 43?
Yes. 48.
48?
I look pretty good, right?
But you look very good. I must tell you, your face looks beautiful. Your skin, and your husband did everything, right?
Yes, he did. Everything.
And you are the person that we should talk to, because if we're nervous about any kind of plastic surgery.
Absolutely.
She is the person to talk to, no question about it, because she is one of the most informed people. She's been in plastic surgery for many, many years as an expert. She works with me in the operating room. So it's more than just a person who gets plastic surgery. It's a person who knows plastic surgery very well, and she's worked with most of the top plastic surgeons in New York City. And that's a good thing.
There's no discomfort. There's no downtime. You'll heal right away.
Right.
What's the heal time?
Within a week.
Oh my God.
Many procedures I've had, I've gone to work the next day.
Amazing. Your face is beautiful. This right here is perfect. Perfect. You really look amazing. Amazing. Tell my audience, where can we go to find out more information?
The website?
Tell my audience the website. Where can we go to find out more information?
Pober at AOL.com.
Do you have a Facebook?
No.
Not yet. Not yet.
Work
on that. All right, darling. Let's toast.
Thank you, darling.
Yeah. There's no champagne in this. Let's toast. Let's toast to looking younger and more glamorous.
Plastic surgery is the way to go. No question about it. Plastic surgery is the way to go, and especially cosmetic medicine as well.
More interviews coming up. Keep watching Pink Champagne Kisses.
Fancy dress to impress. One of a kind girl. It's been a Crybaby Productions, darlings.